I'm Rick Buck and I've been a dentist for 15 years. In this video, we will go over most of the possibilities as to why your mouth becomes sensitive or painful after a tooth extraction. So like and subscribe if you have teeth. The first mechanism of pain after an extraction is called dry socket. Now, this does have more formal names, but I actually find those formal names to be misleading. You see, when you have an extraction, you can expect at least some mild to moderate pain. That pain normally starts to decrease or subside as the days progress. However, for some people, the pain starts to increase on the second to fourth day after an extraction, which means you likely have developed dry socket. This pain can be very, very painful. For some people, it's moderate, and for some people it's very intense. To ease your mind, everything is most likely going to heal just fine. It's just a matter of getting through the pain for a few days to maybe even possibly a week, which is the hardest part. You see, when the tooth was extracted, the dentist or the surgeon had to put a lot of pressure on the bones surrounding the tooth. We do this on purpose. We almost use a prying motion against the tooth and the bone. The blood supply to this bone is important for the healing process once the tooth is taken out. But the blood supply to the bone surrounding the socket can be reduced because of the pressure and trauma on the bone during the extraction. Now, this socket tries to heal in time, but the decreased blood supply doesn't deliver the required healing factors to the socket to even maintain a blood clot. So in this case, you likely lost the blood clot, and thus this gets the name dry socket because there's no clot in the socket. Once again, this condition can be very, very painful, but rest assured, everything will heal in time. If your extraction was difficult, you are more likely to develop dry socket. However, I have seen very difficult extractions all the time that have no pain whatsoever after. And then I've seen very simple extractions with a lot of dry socket and intense pain after too. Now also, the further the extraction was towards the back of the mouth, the more common the dry socket will be. Thus, wisdom teeth extractions will often develop dry socket more commonly than, let's say, one of your front teeth. Another important note is smokers are also more likely to develop dry socket. Now, if you've already developed pain due to dry socket, what dentists can do is they can place a material in the socket that is coated with something called eugenol, which is found in clove oil. The eugenol will sit in the socket and sedate the pain for about 24 to 48 hours. So if you're having this pain, you can go see your dentist, and it's most likely that this is the treatment that they will do to help ease your pain. And this can be done with and without numbing. But if done without numbing, it is initially more painful while the material is placed into the socket. Before I go on to other causes of post-operative extraction pain, you need to watch my daily brushing and flossing routine video. It will show you how to optimally take care of your teeth with all the best products that I have tested out in other videos that I've made. These products include my favorite floss, toothbrush, and toothpaste by far. In fact, all of these are also linked to below this YouTube video as well, but you can see why they are my favorite and the stunning results that they get in a video that will pop up at the end of this video, and there you'll learn the best technique to take care of your teeth. Now let's move on to what a lot of people are most afraid of when they have pain after an extraction: infections. Anytime you have an extraction, this is a possibility, but actually it is not the probability. So your body comes equipped with tons and tons and tons of antibodies, and your saliva has a lot of those antibodies in it to help fight off infection. On top of that, the socket that the extraction left behind likes to heal from the bottom up, and so it's likely to push away any of the material or debris that would likely get caught in there and cause an infection. So therefore, the infection is definitely possible, but what is more probable is that you're just having pain from the extraction or at least dry socket. The thing about infections after a tooth extraction is that it's difficult to diagnose an infection after an extraction because there are a lot of signs of an infection in the mouth that are similar to just normal healing signs for an extraction. So let me explain. It's normal to have swelling after a tooth extraction, but it's also normal to have swelling if you have an infection due to an extraction. What about other things? Bad taste, bad breath, pain, and gum irritation are all common from both normal extraction healing and infections after an extraction. Sometimes the dentist can see if the site looks infected and possibly see pus, which would be a dead giveaway of an infection. But a lot of times it's difficult to determine, and it's a judgment call by the dentist if he suspects an infection. Now, because an infection can be very serious sometimes, what dentists will do is they'll prescribe antibiotics before they even extract the tooth to take before and after, like most people do with wisdom teeth extractions. Then other dentists will prescribe antibiotics at the first sign or suspicion of an infection. So two things you want to really look out for after an extraction that might be a possible sign of an infection. If you're getting rapid swelling after an extraction, meaning in an hour it just is really increasing in size, or if the swelling develops a few days after the extraction, this is not a game. Contact your dentist or go to the emergency room. But yes, infections are a possibility for pain after an extraction. Now let's go on to another cause of pain after an extraction, and that is inflammation. When you have an extraction, this is a traumatic experience. There is pressure that goes on the bone, your jaw joint, the muscles, nerves, blood vessels, other teeth, and other tissues in the area. Any of these tissues or body parts can develop inflammation and cause pain. One of particular interest is the jaw joint, or the TMJ. If too much stress develops and puts pressure on the TMJ, it will cause a variety of symptoms due to swelling in the joint, and there are a lot of important muscles and nerves in that area. So here's a list or some of the things that TMJ inflammation might do. It might make it sore for your mouth to open, so you might have limited mouth opening, or you could have even popping in the jaw as well. For some, it might even affect your hearing in random ways, like you might have tinnitus or even reduced ability to hear, because there are hearing nerves right around the TMJ jaw joint. But whatever random symptoms it produces, it will likely cause pain as well. But also, this inflammation, if you're careful and you baby the area and you take care of it, it will likely subside in time. Now, remember how I said there's a prying motion that goes on the bone? Well, it can also put pressure on the other teeth, which will cause inflammation, and this will cause chewing pain, at least for a little while. So these are some of the more common ways that inflammation can happen because of a tooth extraction. Ibuprofen or other doctor prescribed anti-inflammatories are your best bet to reduce the inflammation and ease some of that pain as well in this case. So that is the best remedy until the inflammation subsides and goes away. So now let's move on to another mechanism. And generally speaking, gum irritation is another possibility to post-operative extraction pain. I know gum irritation might seem like something obvious that would be causing pain after a tooth extraction, because there are just so much gums around that area and there's all this pressure and cutting and drilling and things that are going on. So gum irritation is normal. But there is one thing that possibly increases gum irritation that happens from time to time after an extraction. I'm talking about a bone spicule, or a sharp piece of bone that is poking into your gums. You see, after an extraction of a tooth, a lot of time the edges of the socket will feel sharp to the tongue. In fact, a lot of people will think there are pieces of their tooth left behind, when in fact it's just the edges of the socket where the tooth was taken out. Now, these sharp edges of the socket are normal, and they will likely smooth out in time as the socket kind of heals and smooths over. So nothing really needs to be done about it most of the time. However, sometimes a piece of bone spicule is sticking out in just a way to poke into the gums that causes a lot of pain. If you have a bone spicule and it is painful, sometimes it will resolve on its own, but most of the time it will have to take being numbed up again so the dentist can smooth out or remove that bone spicule. Remember, my favorite toothbrush, floss, toothpaste, and other dental products are linked to below this video. Everyone should watch my daily tooth care routine video I have posted now, and I will show you why in that video it is the best products and the best technique to get your teeth almost spotless every day when you clean your teeth. The results are stunning. If in Southern California, my dental practice is linked to below. Like and subscribe if you have teeth. Who named dry socket? That is a terrible